Hello and welcome to Women's Health. My name is Kathie Uhrmacher. I am the president of the Women's Foundation and the chair of the Mayor's Commission on Women. And this program is called Women's Health. Today we are joined by Dr. Cada, who was here talking to us about the topic of menopause. So, first of all, Dr. Cada, would you tell us a little bit about really what's menopause? I mean, people use that term all the time. They say things like perimenopause and menopause, and I'm not sure that everyone has their own individual definition probably, but what technically is medically menopause?
So menopause is the time in our life when our ovaries stop functioning, and perimenopause is the time period right before that. It averages about 4 years when we're having a lot of hormone fluctuations, and then finally the ovaries stop. The way we define menopause medically is when you've been a year without periods. So it's not a specific hormone test, blood test. There's no perfect test to say this is menopause. We do it based on, I haven't had any bleeding for a year.
Okay, so it's different then for every person.
Yes.
Okay.
Yeah.
So generally, time frame wise, when can women plan that this will be the time of their lives? I mean, what age level are we talking about?
Yeah. So it's supposed to start around age 47 and then on average be done by age 51. But it really varies from woman to woman. And our maternal history, so our mother's experience, is supposed to be the biggest predictor for what we experience.
Really?
Yeah. But I've also had women that have started in their 30s and their 40s. I've had women that have hot flashes for 10 years, 20 years. Seems like forever. It just really depends on the woman. So.
Sure. Okay, that's interesting. And so perimenopause is the time that's leading up to menopause.
Yes.
Okay.
Yeah.
And then when do you technically know that menopause is done to move into postmenopause?
Yeah, so that would be, so menopause is a year without periods. So a year without any menstrual bleeding is when we say you're menopausal now or postmenopausal.
Okay. So it is really that timeline.
Yeah.
Okay, great. All right, so let's talk then about what the most common symptoms are for women, so that if they're experiencing these kinds of things, they know, like if they're in their 30s or like you said, early 40s, and they might think it could be a host of other things and they should go see their physician. So what would be the symptoms that are the most common?
The one that women complain the most about are the hot flashes, or we call those vasomotor symptoms. And so night sweats, women will report that they wake up hot and sweaty, flip off all their sheets, get cold, and then wake up and pull everything back on, or that they have to get up and change their sheets or their clothes, bedclothes in the middle of the night. Those can disrupt sleep patterns, and so then women can be tired and more irritable just because of the lack of sleep.
Sure.
Although the hormone fluctuations can cause sleep issues as well. And then many women will experience menstrual changes. What's supposed to happen is that periods get closer and heavier, but not everybody has that experience. Some women, they'll get lighter and more spaced out. Other women, they'll just all of a sudden stop. So it really can vary, but those are probably the most common symptoms.
Okay. And so then if somebody has a hot flash during the day, okay, that's the same concept, but at a just different time of the day, or is it?
Right.
Okay.
Same concept.
Okay.
Yeah. They get hot. I've had women say, well, I was drying my hair and I had a hot flash and then my hair was all wet and sweaty. I couldn't even finish getting ready. Or I had somebody recently who said she always gets one when she's teaching and she comes to a certain part of teaching every day, a reading program, and then she has a hot flash. She just knows she's going to have a hot flash and get all red and sweaty. So it really varies from woman to woman.
Right,
but, yeah.
right. Which makes it difficult to predict or plan or whatever sometimes, I'm sure, for some people. So when we talk about the hot flash, though, that's primarily hormonal. So pretty much all of this has to do with hormones then.
Right.
Okay, and what are we talking about when we say hormonal? I mean, we're talking estrogen,
So the ovaries put out estrogen, progesterone, and testosterone. Those are their main hormones.
All those three.
All those three. And so the symptoms are related to the hormone changes with that. So we have, so our ovaries are down here. We have a hormone in our brain that sends messages to our ovaries and says, good job, keep it up, let's see some more estrogen, pick it up a little. And so that message keeps going, but the ovaries stop responding quite as well.
Okay.
And so they'll be a little bit slow to respond, and then all of a sudden they'll say, oh, wait, here comes the estrogen. They'll send out a surge of estrogen, and then women will have heavier bleeding or some of the other symptoms like the hot flashes.
Okay. Now, when you start to then slack off and there's not as much estrogen, does that mean there's more progesterone or testosterone that come in, or do they level off too?
Yeah, everything starts to gradually drop, but what happens is because the ovaries aren't responding quite as well, and so I call it the gas that makes them go. That's the F.A.C.O.G, or the follicle stimulating hormone that comes from the brain. So that starts to get higher. It's saying work harder, put out more estrogen. The ovaries will say, oh, right. That's our job. We forgot. We were going on vacation. And then they'll
We're tired.
put out hormone surges. So you get a lot more hormone fluctuations.
Okay.
So I like to explain to people it's kind of like reverse puberty. So when you're going through puberty, your ovaries are starting to wake up and figure out how to function. And so between, on average, the ages 12 and 16, teenagers we expect are going to have lots of hormone fluctuations, irritability, period changes, acne, bloating. And that's the same thing we get to experience again when we're becoming postmenopausal.
Okay.
Yeah.
So that's discouraging for some of us anyway. By the time you make that transition, it's
Yeah.
like, here we are again.
Yes,
right? Oh,
here we
that's
are
funny.
again.
So now you mentioned the FSH, and I
Yes.
know that some people will trot off to the doctor to get an FSH test. What does that mean?
Yeah, so the FSH is a hormone made by the brain that tells the ovaries you need to put out estrogen. Then the estrogen from the ovaries comes back up to the gland in the brain and says, here I am, this is the level. And it either says this is a good level, that's fine, let's keep it where we're at, or make some more or make some less. So as the ovaries function less effectively, they put out less estrogen. So there's less estrogen going up to the brain, so the hormone levels go up. The FSH level, the gas that makes the ovaries work, goes up, saying, okay, ramp it up. This isn't enough, ramp it up. And so that level goes up and estrogen level goes down. So when women are postmenopausal, the FSH level should be high, because that's the gas that makes the ovaries go. And the estrogen level that comes out of the ovaries should be low.
Okay.
We think the number one hormone that affects how we feel the most, the hot flashes and that, is the estrogen.
Okay.
The progesterone, not so much. The testosterone, some.
Right.
But really the hormone we think we need the most is estrogen.
Now, do most women need to go to see the doctor when they're going through all these things, or do they go because they have the symptoms, because they really need to take a test, or is it pretty much just up to the individual?
I think it's up to the individual. You know, back in the 60s when they came up with synthetic estrogen, and what they used to do is say, okay, you're going through menopause, here's your estrogen, it's the fountain of youth, it will make your skin younger, it'll make you feel better, just keep taking
Sure.
your hormones. And then they did some studies it was probably the late 90s, the Women's Health Initiative, a nationwide study, a really big study, and they found that maybe estrogen isn't quite as safe as we thought it was.
Right.
And they halted the study early, and they said, okay, it's not the fountain of youth, it does have some drawbacks. Really, instead of just saying, here are your hormones, we should take women individually and counsel them. What are the risks for you? What are the benefits? Is it really something that is good for you in particular? So we're supposed to assess women individually. Mm-hmm. Not everybody has problems. Some women just sail through it. I tell them to be awfully quiet in the waiting room. And other women might throw rocks at them in their hormone surging moments.
Is it your experience that the majority of women do seek some kind of relief, though?
Well, one of my jobs is a gynecologist, and so I see women for yearly visits, but I also see women because they want something fixed or are looking for help.
Right.
So I may be biased and think everybody has hot flashes and wants me to fix them for them.
Right. Yeah.
Yeah.
And you're not seeing the ones who are just sailing through, probably.
No, because they're happy. They're out living their lives, saying,
They're
"Yay!"
okay. And very envious. The
Yeah.
other ones are very envious.
Yeah.
Okay, let's say though that you are a person who is really debilitated by this. I
Yeah.
mean, that it's affecting the quality of your sleep, or it's affecting the quality of your life and, your work and whatever. What are some of the treatments then that are there or that are available that a woman can use?
Right. So, yeah, and I think that's the moment when it's affecting your quality of life that really you can benefit from probably making some kind of changes to try to make your life
Right.
better. What's the point? And that's what women tell me, like, I don't care what you give me, this is terrible, make things better for me.
Well, because if you think about it, that's a period of time in our lives when we're really busy.
Right.
We have got careers, we've got family, we've got not only just children, but parents sometimes that are depending on us and lots of things going on. So
Right.
it's a really high volume period of time in our lives where we have lots of things going on.
Right.
So if you do have symptoms that are really affecting the quality of your life and you're able to performance, it
Right.
can be a real issue.
Right.
Right.
Definitely. Well, first, what I go through with women is, okay, sometimes for some of us we can identify triggers for the hot flashes. So there's things that we're doing, and if we know what those things are, maybe we can modify our lifestyle to make our hot flashes less.
Okay.
So for some women, for example, stress can affect hot flashes. And so the more stressed we are, the more hot flashes. Take, for example, the woman that said, I get to this point in my work every day and I have a hot flash. So sometimes learning something to deal with stress can help, like deep breathing exercises. There was a small study that showed that if you match your inhalation with your exhalation for 20 to 30 minutes a day, you can decrease the number of hot flashes that you have during the day.
Really?
Other things, sometimes spicy foods, hot weather or hot foods, also caffeine for some women, so coffee or tea, alcohol for some women. I tell women, okay, I know for me, if I have a glass of red wine at night, I'm going to have a hot flash at 2 in the morning. And so what I have to decide when I'm having dinner is, do I want to sleep tonight or do I want a glass of red wine at dinner?
There you go.
And so that's something for women. If you can identify this is going to trigger a hot flash, maybe you can make some adjustments.
Sure.
I'm not going to drink coffee later in the day, or I'm going to go for a walk and try to bring my stress level down, things like that.
Sure.
And then there are some non-prescription treatments that you can do for hot flashes. And so, for example, you can do, for example, soy milk or soy products. They have plant estrogen in them. We think they're relatively safe, although I've had some women that ingested so much soy, they started to have abnormal bleeding or breast tenderness. So those are things, they have natural estrogen in them, but it could be possible to take too much and then get other symptoms from them.
Sure.
So plant estrogen. So 2 cups of soy milk a day, for example, in 40% of women decreases their hot flash intensity. So that's one option. We talked about the deep breathing exercises. Just exercise in general seems to be better for women. If women that exercise more, they seem to have less hot flashes.
Right.
There are some herbal compounds like black cohosh or wild yam cream that's supposed to have progesterone in it. Those substances aren't prescription, they're not regulated by the FDA, so the amount of hormone from one sample to the next could vary. So I think that's important for women to know. I have a patient that uses wild yam cream and then a synthetic estrogen. And so she started having some bleeding, so she started using her wild yam cream more to counteract the bleeding she was having from the estrogen. So there's there's all sorts of things that you can do to try to help with your symptoms. We do know that if you have a uterus, you have to have progesterone with the estrogen. Otherwise, if women have had a hysterectomy, they can just do estrogen, which we think is the most beneficial.
Okay.
In that Women's Health Initiative, the women that had breast cancer, which is what many of us worry about with hormones, those women, it was really the women that were on progesterone that had it. The women that were on estrogen alone didn't have an increased risk of breast cancer.
Is that right? So are a lot of women using hormone replacement therapy now because of all the controversy, or has that really backed off?
I think it's less than it was. It used to be pretty universal, it seemed, that women were on hormones, but now it really seems to be quality of life. So if I can't sleep, if my joints ache, if I have a leaky bladder, my memory's not working, hot flashes, those are all reasons that women want to go on hormones and feel like the benefit to their daily life, their ability to function, outweighs the risk of breast cancer, heart attack, stroke. And those risks in the study, in that Women's Health Initiative, really were fairly low. It was enough that they stopped the study, but it was maybe a 1% increased risk.
Right. So again, as with all things, I think it's important for us to become educated, and that we have to be careful not to look up sometimes information that we could maybe see on the internet, and that may not be really reputable. Are
Right.
there websites that you recommend for women who are really, okay, I've got this situation, what should I do? Where do you think the best information comes from?
I think that the Mayo Clinic website and the WebMD websites are probably two of my favorites to recommend for patients. The information seems pretty reliable and
Good.
pretty accurate.
Okay.
So those are the ones I usually send people
I think
to.
that's important, because in this day of information, we think we can get on the internet and we can find all this information, but then again, it's not always something that can be reputable. So I really appreciate hearing that, because I think women need to know that there are places that they can get some answers, but they have to be careful to make sure that they're reputable ones. Let me ask you, when we look back through the generations, I noticed you mentioned something historically about the 60s and then, moving ahead from there in the 90s. When we look back through history, do we really see some changes in this kind of menopause situation for women? I mean, if we look back a couple of generations, were women better off, less better? Are there things that are changing that? Because it seems to me, when I look back, and maybe it was just because people didn't talk about it so much, but it didn't seem like menopause was such a big deal when women, my grandmother's age, for example, were going through that. And now there's just maybe it's an increased awareness, but it seems like women have much more difficulties with it, maybe. So I'm wondering if that's just because I'm just imagining it, or if that was really true.
I think there's a lot more dialogue about it. I think women are more open about it and talk more about it. I've had women. I remember a woman I had who isn't with us anymore, but was in her 90s and was on hormones, and said to me, "You're never taking my hormones away from me. I don't care what the news says. I want my prescription."
There you go.
So
She knew what she wanted and what worked for her.
Yeah, and that was 10 years ago. So she was, maybe somebody who might have been your grandmother's age or older, but was on hormones and said, "Don't take these away from me."
Which that was her experience.
That was her experience. And so
Yeah.
I definitely have women that say that to me.
Yeah.
"These are mine. I don't want to talk about it. Don't even ask me."
Well, that's true, and they know what they want.
Yeah.
Well, the reason I mentioned it, and I think that that's probably true, is that it seems like there is a lot more talk about it. So that's probably true that these were things that were happening before, but maybe they just didn't talk about it as much. On the other hand, when I look back, I think that there was probably more exercise and more natural foods and more other kinds of things that those women were doing that maybe some of us, because of the type of jobs we have or whatever, are not as active, not as much outdoors, and probably have more processed foods or whatever. I mean, who knows what it could be. So
I completely agree.
yeah, that's true. Now, when we get past menopause then, what are some things that we need to look for?
Well, one thing is that our cholesterol can start to go up, and we can start to put more plaque in our arteries. So our risk of heart disease is supposed to approach what men's is around menopause when our hormone levels start to drop. So I think that's important for women to know.
Okay.
And so exercise and looking for heart disease, which is the #1 killer in our country, is very important. So taking care of ourselves, eating a low-fat diet, and staying in shape, I think so important to prevent the #1 thing that affects all of us.
Right.
And then the other thing, as our estrogen levels drop, our bones can start to get thinner. And so exercise can help with that, taking vitamin D because our skin doesn't metabolize vitamin D as well as we get older. Making sure we're getting enough calcium through our diet, I think is important for that as well. And then for some women, especially women at high risk, we'll start doing bone density scans at some point just to see how their bones are aging.
Okay. And we have done a program on osteoarthritis, that kind of thing, osteoporosis. So we definitely would want to tell our viewers that if they're interested in that particular topic, there are many programs that we do here on Women's Health that are still available out there that people can look at that information. And I think that would be really helpful too. We always hear about weight gain, and is that because of the time in your life and you just sit down and you don't exercise as much, or does weight gain is that really a result of menopause?
I think the hormone changes related to menopause seem to make us put more fat around our middle, and I think that goes back to the changes in estrogen also make us put more plaque in our arteries. It makes our bones age faster. We kind of start to, as we lose the estrogen, some parts of our body kind of change like men. So as opposed to putting the fat around our hips, maybe more in our tummy.
Okay.
And I've had women that were exercise fiends that said, I cannot get rid of this fat around my tummy. What can you do to fix it? I don't know, liposuction, there's really not a perfect, I wish there was a perfect hormonal balance, like something that I could help somebody with to get rid of the fat around the middle. But it seems to be some of it probably genetic, hormonal, and it doesn't seem to be that there's much that's effective at
So that
fighting
really
it.
is a result of the lack of estrogen than the thing around the middle.
And for some reason, it doesn't seem that hormonal treatments can remedy that.
Is that right?
Yeah.
Interesting.
Yeah.
Okay. So exercise is really important for us in lots of ways, but to assume that that's going to take care of that is not going to happen.
Yeah, it doesn't always. And I don't have a magic pill for that. I
You
wish I did.
So it is reasonable then to expect that there will be some weight gain after menopause.
There can
Okay.
be. And our metabolism really starts slowing down in our 40s. And so that's where cardiovascular activity like walking or elliptical or something like that is so important. And then weightlifting is important, weight resistance, because that raises our metabolism. And so I tell women, if you're not actively doing something to build your muscle mass, your metabolism is going to go down. You're going to eat what you always ate, but your weight's going to go up.
Really?
Yeah.
So like weightlifting, that kind of thing?
Weightlifting is really important.
Oh, okay. Well, that's really interesting to know. Well, this is Dr. Sarah Cada, and we want to thank you so much for being with us again. We really appreciate it.
Yeah, likewise.
This is Women's Health, a program that is sponsored by the Mayor's Commission on Women and funded by the Women's Foundation. Again, if you are interested in this topic or others, we have listed some websites for you there. And also the website for Gynecology and Fertility P.C., which is Dr. Cada's organization. We would also really encourage you to look at other women's health programs, and those are always available to you either on these stations or if you would like to go to our website, which is lincolnwomen.org. And all of the health programs that we've done for women's health are there, and you can use those links to view any of our programs. So again, we want to thank Dr. Cada for being here and thank all of you for watching, and this is Women's Health.